start recording here. Hello. Okay, so I do want to talk about the concept of dual innervation. And as you know, there's two divisions of the autonomic nervous system. We have the sympathetic, the fight or flight, and the parasympathetic, the rest and digest. And it's interesting because my daughter had braces put on today, and I went to the orthodontist, and I actually asked him if it was okay because she takes Taekwondo. And so she has to get tested in her class this week. And I asked him, is it okay? Can she do the Taekwondo class for her test? And he says, let me tell you. And he started breaking down the sympathetic and the parasympathetic nervous system to me. So I was actually quite excited that my daughter's orthodontist is well versed in the autonomic nervous system. It makes me very, very assured. But anyways, I digress. Let's talk about dual innervation. And basically what dual innervation is when our effector organ is going to receive information or input from both divisions, from the sympathetic and the parasympathetic. Now, these effects, all right, from both of these systems can be antagonistic. They can oppose one another, or they can be cooperative. They both can work towards the greater good. Okay, so you have two choices: antagonistic effects, all right, or cooperative. So when they're antagonistic, they're going to oppose one another. And a good example for that is the heart rate. Okay, so when your heart is beating, all right, your sympathetic nervous system will increase your heart rate, whereas the parasympathetic nervous system will decrease the heart rate. Now, I know in one of our previous classes I talked about how the heart can beat on its own. You have these pacemaker cells, and it causes the heart rate to beat on its own. And you'll talk more in detail on that when you get into the cardiovascular chapter and the heart chapter. But it's really your parasympathetic, the vagus nerve, cranial nerve 10, that actually slows your heart rate down and gives you whatever your resting heart rate is. Okay, normally it would be much higher than that. The normal range for heart rate is 60 to 100 beats a minute, on average 80 beats a minute. All right, so it's vagus that really has a big role in that. So if you start to exercise, like walking up the stairs here, all right, when you start to exercise, your heart rate will increase a little bit, increasing more what we call cardiac output, more blood output from the heart. And part of that is from the elevated heart rate. Well, sympathetic nervous system increases the heart rate, all right, whereas the parasympathetic nervous system will slow it down. Okay, so keep that in mind. All right, another example, all right, of antagonistic effects is in your GI tract. Okay, when we're talking about the muscular activity, the smooth muscle activity specifically. All right, whereas remember, the parasympathetic is the rest and digest. So your parasympathetic nervous system is going to stimulate and activate your GI tract motility. It's going to stimulate what we call peristalsis, that smooth muscle contraction relaxation, which moves through food through your GI tract. So that's the parasympathetic is going to actually increase GI tract motility, whereas sympathetic will decrease it. And I always say, you know, there's really no point. If you're going to run a marathon, I don't really need to be moving my bowels on a marathon, all right? That's not going to be ideal because it's going to kill your time, okay? So when you are exercising or when you're in a fight or flight situation, that pretty much shuts down your parasympathetic division, slowing down the GI tract motility, okay? And then finally, the third example here is the pupil, okay, the diameter of the pupil. All right, and I told another section this last night. In older cartoons, when a cartoon character got surprised or scared, their eyes would get really big. And this is how I remembered how the sympathetic nervous system affected the pupil. When you stimulate the sympathetic nervous system, your pupil diameter will increase, okay, like acting in surprise. You want to take as much light in and have as sharp a vision as possible, all right, when you're in an emergency or an exercise situation. Whereas the parasympathetic will decrease the diameter of the pupil, okay? So parasympathetic will decrease the diameter, okay? Whereas sympathetic will dilate or open up the pupil there. Okay, we'll talk a little bit more about that when we get into chapter 16 about pupil dilation and constriction, okay? But it's the parasympathetic that are going to stimulate the circular muscles of the iris, which are these sphincter-like muscles. So here's the iris here, and they kind of look like this. All right. And then the other one, all right, for the sympathetic are the radial muscles, all right, and then they look kind of like this. Their fibers just kind of radiate out, okay? So when the sympathetic contracts, it'll pull it open and make it bigger. It'll go from that to this, okay? You know, I'm sure you folks will be so happy when the semester's over and you don't have to deal with my horrible drawings. All right? And I really feel ashamed when I show you this. Okay, so that's dual innervation with the antagonistic effects. Cooperative effects, all right, both divisions, all right, yes, they'll have different effects, all right, on whatever they're going to engage in, but it's going to be all in the same overall response. Perfect example is for male sexual function, okay? For intercourse, all right? Parasympathetic helps the male to obtain an erection, then the sympathetic will actually cause ejaculation. But it's all part of the same sexual act. That's what we're talking about. So it's a cooperative effect, okay? So you're going to see more antagonistic, all right, effects compared to cooperative effects. But that's just one of the examples there. Okay, so I want to jump back into, you know, we talked about dual innervation, okay? But you can still have opposite effects, all right, but only involve one division of the autonomic nervous system, okay? So we're going to talk about specifically the sympathetic division, okay? So when we talk about opposing effects, all right, for the sympathetic division, all right, you don't need dual innervation to have opposing effects, which goes back to blood vessel diameter, okay, that vasomotor control, okay? Remember what we talked about it was last week, all right, in which you have your blood vessels are only under sympathetic nervous control. Parasympathetic doesn't play a role in that. You know, what that means is the sympathetic nervous system is always releasing a neurotransmitter, okay, onto the blood vessels to keep them in a partially constricted state. Okay, so as you're sitting here, your sympathetic nervous system is stimulating your blood vessels to be partially constricted, okay? So if you want to constrict them more, you just turn the dial up a little bit on the sympathetic nervous system. It releases more neurotransmitter, and it causes vasoconstriction, all right? But now, let's say, instead of doing that, you want to vasodilate. No problem, okay? No problem. What we'll do is we'll turn the dial down on the sympathetic nervous system. So then the sympathetic nervous system starts to release less neurotransmitter, all right? So it's not as active. And so when it does that, okay, it causes vasodilation. Or if you shut it off completely, then you'll get maximal vasodilation, okay? So that's one way that we can get these opposing effects without dual innervation. We don't need to bring in the parasympathetic nervous system. All we need to do is either turn up the sympathetic nervous system or turn it down, right? And we'll get those opposing effects, okay? Couple other structures, all right, that you can have, all right, opposing effects just with one division, the sympathetic, sweating, all right? If you don't want to sweat, don't activate the sympathetic nervous system. If you want to sweat, all right, in the trunk, stimulate the sympathetic nervous system. That'll stimulate the glands to sweat in your trunk area there, okay? Also goosebumps, okay? The erector pili muscles are affected by the sympathetic nervous system, okay? So if you want goosebumps, stimulate the sympathetic nervous system. If you don't, turn it off, okay? And then finally, our adrenal medulla neurosecretory cells. Remember that last pathway that we talked about last week, all right? The adrenal medulla pathway with our preganglionic neuron. The preganglionic neuron sits right here in the spinal cord, all right? It enters out through the anterior root, goes into the spinal nerve, enters into the sympathetic trunk through the white ramus, doesn't stop, doesn't synapse, leaves the sympathetic trunk, all right? It's on its way to the prevertebral ganglion. Forget that. I don't have time to synapse there either. It goes directly to the adrenal medulla, and it synapses there. It stimulates those neurosecretory cells to release our epinephrine and our norepinephrine, okay? So that is another way that we can see that you get opposing effects. You want to release norepinephrine and epinephrine into your bloodstream, stimulate the adrenal medulla, the sympathetic nervous system. If you don't want it, don't stimulate the sympathetic nervous system, okay? Has anyone here ever heard of this, Raynauds? I have people saying it to me all the time. I got cold hands. I got Raynauds. It's like, no, you just have cold hands, all right? All right. Some people, Raynauds is a condition here, all right, that is caused by an exaggerated response by the sympathetic nervous system. And what will happen is, all right, what I just said, take this off. What I just said, that sympathetic nervous system, all right, it is going to control the diameter of your blood vessels. So, like I said, if you turn up the sympathetic nervous system, then that is going to cause vasoconstriction of the blood vessels. If you shut it down and turn it down, then it causes vasodilation. So we get an exaggerated response, all right, that sympathetic nervous system starts to go haywire, all right, and it increases its stimulation to the small, tiny arteries in your fingers, all right, and that causes vasoconstriction. So we start to prevent blood from getting to your distal digits, so your fingertips will start to turn blue, okay? Of course, when you start to restrict blood supply, all right, to tissues, the tissues, it's called ischemia. One of the early signs of ischemia is decreased blood flow, all right, decreased redness in the area there, all right, but then the tissues start to function abnormally, right? They don't necessarily start to die, but they will, all right? So you start to get pain in that region there, okay? So two causes for this: cold, right? But cold will cause that response, but not to this degree, okay? You go out, well, I don't know if I hate to say this, I don't want to give the people at home the impression that there's not tons of people in my classroom, all right? But if either one of you, if you ever lived in the north or in a very cold environment, all right, you go outside, you know, and like negative 10 degrees, all right, you're going to decrease the blood flow to your extremities, all right? But it's not horrible, because your body has to cope with that if you got to brush the snow off your car. But with Raynauds, it happens almost immediately. All right, you start to get blue fingertips. It's crazy. All right, and the pain is usually pretty, you know, I won't say excruciating, but it's very noticeable. All right, or you can have a lot of emotional stress. Okay, and again, this is one of those conditions that we do see it more in women than we do men. All right, autonomic reflexes, folks. I'm doing you a favor. Well, I'm not doing you a favor, but I'm going to stress this to you, that this right here, what I'm going to talk about here, is going to be huge, all right, in 211, okay? Because when you get into the other systems, a lot of those other systems focus on these visceral reflexes, all right? So if you really understand this concept now, awesome. Because when you start to learn the endocrine system, all right, respiratory system, digestive system, you're going to talk a lot about these autonomic reflexes. So I'm just going to give you the broad kind of outline, all right? So we already learned about a reflex arc in chapter 14, okay? And so we know that there's a couple things that are involved in a reflex arc, and we're going to see that here. So a reflex, all right, is a pre-programmed response. But of course, we need to have a stimulus, all right? You can't have a reflex without the stimulus. So once the stimulus occurs, then it's going to trigger our reflex arc, okay? So we start off with the stimulus, all right? Then that stimulus is going to activate a receptor, and then we know the rest of the story. That receptor is going to send sensory information, all right, via the sensory neuron or neurons up to the control center, which is going to be, all right, our spinal cord or our brain. Okay, it goes to the control center, okay, and it gets integrated there and processed, and then the control center or central nervous system decides on how it's going to respond to that stimulus, okay, and then it sends its decision down to the effector organ, and we know the story. It goes down through the motor neuron to the effector, and since we're talking about visceral reflexes, that's going to include as the effectors what? Give me one effector organ. Well, yeah, okay, so you're giving me specifics. I was just going to say cardiac muscle, smooth muscle, or glandular tissue. All right, yeah. But yeah, you'll see it like when you talk about the digestive system, all right, when we start to increase motility, it's the smooth muscles in your intestines, all right, and in your stomach that start to move things. You ever notice that after, well, it's not immediately after a meal, but if you have a decent meal, you might have to go to the bathroom, all right, soon after, all right, and that's because you've triggered, all right, that reflex, that gastrointestinal reflex to move the food through your digestive system, all right, and then your large intestine is going to start to empty more feces into your rectum, putting a stretch on the rectal walls and stimulating those stretch receptors, and there you go, all right. And again, I could go into it, and I always have to stop myself because you're going to learn all this. I don't want to take it all away. So in our autonomic nervous system, you're going to be dealing with these three effector organs: cardiac muscle, smooth muscle, and glandular tissue. So you're going to jump right into 211 right away in chapter 17 because that's the endocrine system. So that's all you're going to talk about. And you're going to see this reflex arc, this whole thing. That's why it's really important that you understand all those components. All right? So without even thinking about it, you will hit all that stuff, all right off the gun. Okay, so let's talk about cardiovascular reflex, blood pressure. Okay, I'm going to give you a little bit of an introduction to it. We'll talk about it in more detail, all right, in chapter 19, I believe. All right, so you got a situation in which your blood pressure is elevated, okay, and you have these stretch receptors, all right, they're called baroreceptors. We'll talk about that in chapter 16, okay. So these stretch receptors, all right, detect that increase blood pressure. Now, blood pressure, all right, is BP is equal to heart rate, where's the X on here, times TPR, okay? So what that is blood pressure is equal to heart rate times total peripheral resistance, okay? So if you increase, either one of these, you'll increase your blood pressure. Okay, so if I decrease either one of those, all right, then I'll decrease my blood pressure. Okay, so blood pressure is increased for whatever reason, and the baroreceptors in the vessel walls detect that. Okay, so they're going to try to decrease that signal. So the stimulus is increased blood pressure. Okay, the receptor, all right, monitors that. All right, is stimulated by that increased blood pressure. It sends the sensory information to the medulla oblongata, because remember, that is where your vasomotor, all right, your blood pressure center is located, in the medulla oblongata, okay? So it sends the information there, all right, that's the control center, all right, your brainstem, and that brainstem then will then shut down any type of sympathetic information, all right, input to the heart, all right? Because remember, what increases the heart rate? The sympathetic nervous system. Parasympathetic decreases the heart rate. So what's going to inhibit immediately any sympathetic input to the heart, okay? While it's doing that, which is kind of cool as it's doing that, so it inhibits the sympathetic. Meantime, it's going to activate the parasympathetic, the vagus nerve, cranial nerve 10. So vagus then is going to slow the heart rate, okay? So remember that equation, BP, okay, is equal to heart rate, okay, times total peripheral resistance. Okay, so we're decreasing the heart rate, and if we decrease the heart rate, we're going to decrease the blood pressure. So as we slow the heart down, all right, the amount of blood that's ejected out of the heart, it's called the cardiac output, is decreased. So you'll have less blood flowing through your blood vessels, okay? Then you'll have decreased blood pressure. You'll get into this in more detail, but you kind of see how that works a little bit. Trust me, you'll go over it many, many more times. All right, let's talk about going to the bathroom. All right, the GI, gastrointestinal reflux. This is kind of what I was briefly talking about earlier. All right, so as your large intestine starts to move, all right, more fecal material into the rectum, it is going to stretch the rectum out a little bit. You have stretch receptors there in the rectum. They're going to send information to the spinal cord. Last class we talked about this, that the urination and defecation is a spinal cord reflex. It does not have to go up to the brain, okay? That's why folks that become paralyzed, either quadriplegic or paraplegic, usually lose control of their bowel and bladder habits because it's S2, all right, through S4, all right? Those spinal levels control defecation and urination. So if you lesion the spinal cord above those levels, then you usually lose control of that. All right, so it sends that information to the spinal cord, right? And then the spinal cord, through the motor neurons, is then going to stimulate the smooth muscles in the rectum to contract, okay? At the same time, it's also going to stimulate the internal anal sphincter. That's a muscle, it's a smooth muscle. But now, thank goodness, we have the external anal sphincter. That's skeletal muscle. That's the muscle that we learned to control when we were potty training, okay? So hopefully, you know, we can get to a bathroom in time before that pressure, you know, overcomes that skeletal muscle, okay? Micturition, very similar, okay? So as the bladder starts to increase volume, okay, with urine, okay, it causes a stretch. That's our stimulus. That stretch, all right, is going to stimulate those baroreceptors that are going to stimulate that information to the spinal cord again, okay? And then that spinal cord will then send via the motor neurons back down to the smooth muscles in the wall of the bladder, all right, to start to contract. At the same time, all right, your urinary sphincters will relax, except for your external urinary sphincter, because again, that's skeletal muscle. We control that, okay? Questions about that? It's not too bad. If you're understanding this, then I think you guys are going to be okay when you get into 211, okay? I'll show you. I'll even show you a picture here of the urination autonomic reflex. You're going to see the same one in your book, okay? So here's our bladder. It's starting to fill up with urine, okay, which is putting stretch on the urinary bladder walls, okay? That sensory information gets sent up to the spinal cord, all right, in the sacral portion of your spinal cord, okay? And then it's going to stimulate that motor neuron, all right, to send motor information down to the walls of the urinary bladder. The smooth muscles there will start to contract, while at the same time it's going to stimulate, all right, the internal urethral sphincters here to relax. So urine can then move out of the bladder, okay? This right here is going to be your skeletal muscle. That's where you're going to be able to control, all right, when and where, hopefully, where you're going to urinate. Questions? Not too bad, right? Okay, all right. All righty then. Well, that's the end of that one. Pardon?